Bismillahirrahmanirrahim. My name is Shehzad Khalid. I am an operation theatre technologist. I am currently working as a lecturer and clinical coordinator in the University of Lahore under the Faculty of Allied Health Sciences in the Department of Health Professional Technologies. Today I am going to discuss what is hemodynamic disorder. Before discussing the hemodynamic disorder, I want to discuss what is hemodynamics. Hemodynamics are the dynamics of blood flow. Blood flow ensures the transportation of nutrients, hormones, CO2, carbon dioxide, at a body temperature regulation, and protection from the microorganisms and mechanical harms. Hemodynamics. The study of blood flow is called the hemodynamics. The study of properties of the blood flow is called hemorrhology. Any change in the normal dynamics of blood flow leads to the hemodynamic disorders. What are the hemodynamic disorders? There are following hemodynamic disorders: edema, hyperemia, congestion, hemorrhage, thrombosis, embolism, infarction, and shock. What is edema? Edema is the abnormal accumulation of the fluid in the certain tissue within the body. The accumulation of the fluid may be under to the skin, usually in the dependent areas such as the leg and lungs. Edema happens when excess fluid stays within the body tissues. Peripheral edema. In peripheral edema, this affects the feet, ankles, legs, hand and arms. In pulmonary edema, excess fluid collects in the lungs, making breathing difficult. Cerebral edema. This occurs in the brain. Macular edema. This is the serious complication of diabetic retinopathy. Edema. Edema divided in two categories: localized edema and systemic edema. What is localized edema? Localized edema subdivided into inflammatory and mechanical edema. In inflammatory edema is the combination of increased blood flow due to the arterial vasodilation and increased leakiness of the capillary endothelium. In mechanical edema, blockage of the lymph vessel, pleurosis, neoplasia, chemotherapy, radiotherapy, change to lymphatics. Systemic edema. In systemic edema, increased hydrostatic pressure, congestive heart failure, venous obstruction, deep venous thrombus, cirrhosis, and constrictive pericarditis. Systemic edema. In systemic edema, reduced osmotic pressure, liver failure, nephrotic syndrome, sodium and water retention, acute renal failure. Edema in congestive heart failure, right-sided heart failure, right atrial pressure increase, systemic venous pressure increase, systemic centrilobular liver congestion, lower extremity edema. Hyperemia. Hyperemia is the increase of blood flow to different tissue in the body. Hyperemia and congestion both indicate a local increased volume of the blood in a particular tissue. There is increased vascular volume. Hyperemia is an active process, arteriolar dilatation and arterial side. Congestion is a passive process, impaired the outflow of blood, venous side, which may be the systemic or local. Hemorrhage. Hemorrhage is an escape of blood from the rupture of the blood vessel. It may be internal and external hemorrhage. In internal hemorrhage, blood escape in the body, and in external hemorrhage, blood leaks outside of the body. Thrombosis. Thrombosis is the formation of blood clot known as the thrombus within a blood vessel. It prevents blood from the flowing normally throughout the circulatory system. Venous and arterial thrombus. Thrombus have two types, venous and arterial. First of all, I am going to discuss what is venous thrombus. Venous thrombus may be superficial and deep venous thrombus. Superficial venous thrombus causes local edema, pain, perhaps ulceration, rarely embolize. Deep venous thrombus rarely cause local pain due to the collateral but often embolize with significant consequences. In arterial thrombosis, atherosclerosis, mural thrombosis. In atherosclerosis, the rupture of the plaque induces clotting and occlusion of the vessel. In mural thrombosis, post-infarction or post-infection damage to the lining of the heart induce the formation of clot that can break off and plug a distant site. And next is what is embolism. Embolus is the detached mass that is carried to the distant site from its site of origin. For example, fat embolism, air embolism, amniotic fluid embolism. Next is the infarction. Infarction is an area of ischemic necrosis caused by the occlusion of the arterial supply or venous damage. The nature and extent of the damage is influenced by nature of the blood flow, rate of the development, and tissue vulnerability. Nature of the blood flow. Tissue with the dural or collateral blood flow are less affected compared to the end organs. And rate of the development, slowly progress occlusion tolerated because of the development of collateral roots. And tissue vulnerability, neurons can withstand only 3 to 4 minutes of hypoxia, myocytes 30 minutes, and fibroblasts can survive many hours in low oxygen. Next is the shock. Shock is the systemic hypoperfusion caused by reduced cardiac output or reduced blood volume resulting in hypotension, impaired tissue perfusion, cellular hypoxia, heat stroke, allergic reaction, severe burns, and infections. Next is the types of shock. There are following types of shock: cardiogenic shock, hypovolemic shock, hemorrhagic shock, neurogenic shock, anaphylactic shock, and septic shock. Cardiogenic shock, it is due to the reduced cardiac output. Hypovolemic shock, it is due to the reduced blood volume. Hemorrhagic shock, it is because of the loss of blood volume. Neurogenic shock, due to the vasodilation following nerve cord injury. Anaphylactic shock, it is due to the severe allergic reaction, systemic vasodilation, and respiratory insufficiency. And septic shock, overreactive inflammatory response to infection. Thank you.